also a occupational therapist, for having worked in mental health for many years before I moved here. And it's been a pleasure to talk about this. Of course, most of my experience is with youth and teens, which is why I'm sharing this class with Pastor Andrew. He worked in counseling for many years before joining us here as associate pastor, and it really helps to be able to share that experience. So we are at the end of the series, so if you miss any of the classes, this is the last one. We have talked about the biblical concepts that guide us in a way that we see mental health. We have talked about being made in the image of God, having the image of God being restored in us through Christ. We talked about understanding life through the redemption story, right? That God created us, that one day we will be made new in heaven, that we have been redeemed. We talked about how that affects the way that we look at our health in general, and how specifically it affects our mental health, and how it helps us look at our mental health with a biblical lens. And we set down a bunch of principles. So if you want to go back and watch the classes, if you missed any of them, they are available on the church YouTube channel. If you have signed up and you have your email and you have access to the loop, all the emails that I have shared, all the files that I have shared in past lessons would be available for you on the loop under the group. If you have never tried using the loop, I suggest you do. You can have all the materials from the past 5 classes available there. So we talked about a couple of controversial things, or things that are sometimes hard for us to talk about. But we talked, the last 2 classes, we talked about the role of community and the role of therapy. And today, I think we're taking the heaviest topic just because of how much stigma is around the use of medication for mental health, especially among Christians. So, people have questions. Should I take medication? Can I take medication? If I take the medication, does that mean that I'm not trusting God to heal me? So, I want to invite Pastor Andrew up here, because you think you have a mental problem, you think you have something going on, you're not feeling well, you're in trouble about something. Where do you start? What does treatment look like? Is medication mandatory? Pastor Andrew, help us answer those questions.
Just those questions? Okay. Okay, so the question where do I start is a good one. So I'm going to answer this in 2 ways. First, I'm going to say wherever you're willing to get started. Wherever you're willing to get started. Because some people, when they first start to deal with problems, they may not be willing to go and contact a therapist, look up their insurance, see who they can meet, but they may be willing to maybe talk to a pastor or a trusted friend, right? And that might then lead to follow up with a professional in some way. But sometimes people think, well, I'm not really getting started until I talk to a professional, and I want to kind of challenge that perspective and say, no, start with who you're willing to get started with. Most of the times when I meet with people, I would say to them, at the very least, meet with your primary care doctor, because primary cares, for the majority part, are the first line that sees psychiatric problems and are able to assess in a very rudimentary way if somehow mental health treatment may be beneficial. 99 times, because of how primary care typically works now these days, 99 times out of 100 they're going to refer you to some sort of specialist. Okay? And that's okay, because that bridges you to the kind of person that you maybe want to go see. Now, after you schedule an appointment with a counselor, there are basically two ways of thinking about treatment. One is there are prescribing professionals, namely a psychiatrist or a psychiatric nurse practitioner, that can give you medication, or a medical doctor. Then there's the therapy side, which is the talk therapy, in which you have consecutive sessions. So when you schedule an appointment with the psychiatrist and with the therapist, the very first thing they're both going to do is annoy you by asking you the exact same 100 questions. Because they're trying to determine the things that we looked at last week on that sheet. What symptoms do you have that are presenting to conform to a mental health problem? And then what's a medication that may be appropriate, if any, to address this particular problem? Okay, so you have the medication side. Then when you meet with the counselor, they're going to ask you the same 100 questions, but it's going to be different because that sheet that you have in your hand today is more or less what they're trying to figure out as meeting with you in a one-to-one therapy situation. What do you want your life to be about? What's the problem that brought you in? How is your life being impacted by this problem? What do you want your life to be about? What's most important to you? If you did not have these particular presenting problems, what would you be doing differently in your life? Now, if you talk to a Christian counselor, they're going to ask you questions like, where do you see God in the midst of your problem? What's it like to relate to God while you're going through this depression or this anxiety? In what way has prayer been helpful to you? What in the Bible is encouraging you through this? Right? If you want to develop, from a Christian therapy standpoint, not just the mental health symptoms, but also the spiritual piece, because remember, we're looking at things holistically. After you get a sense in that first session, some of the things that you might indicate on that sheet, the therapist is going to say, okay, of all these things that you want to be working on, which is most important to you? And on a scale of 1 to 10, 10 being very high, 1 being very low, how well do you think you are meeting this goal currently in your life? You say a 4. Okay. Why not a 3? Why not a 3? What are you asking there? The person's then going to say, well, I'm not a 3 because, as depressed as I've been feeling, I still am getting out of bed. As depressed as I've been feeling, I still meet most of my responsibilities at work. As depressed as I've been feeling, I still go to my small group. What is this person telling me? What are they revealing to me? The stuff in their life that's working. The stuff in their life that is keeping them in a better place, right? And that's important as a therapist to know what those resources are. There's going to be some resource gathering in this initial discussion with the therapist. Then they're going to ask, what would make you feel like a 5? What would push you 1 point more? And what is that? That's your first goal you're working on in therapy. So therapy, as you can hear from this sort of this made-up dialogue, is very sort of self-directed, we might say. It's focused on a particular individual. It follows sort of the same pattern for most people, but what you work on can be very wide-ranging and different depending on what you're presenting with. Okay? Now, usually what I say to people, and this is a big fear when people start therapy, when people start medication, what are they afraid of if they start therapy or medication? Okay, stigma, maybe. What else along with that, maybe? Okay, so for medication, it might be addiction. What about with therapy? Is this couch going to be my permanent address for the next 30 years? Should I just put my name on this couch because I'm going to be asked to come here for 30 years? So that's a fear in that when people start therapy, they often think, well, how long am I going to have to commit to this? And unless there's significant impairment, the truth is that as long as you want to. As long as it's helpful. So what I say to people, to be realistic, like taking medication takes time to get into your system. Okay, many medications take up to 4 weeks to actually start feeling really radically different. So it's going to take time. So what I say to people is give it 6 sessions and then assess with them. Give it 6 sessions. Why 6? Well, the first one is really not for you as a client, it's for the therapist to understand what's going on for you. Second session, they're going to start getting a glimpse of how this problem is operating in your life and how you're dealing with it. And then third through the sixth session, they're going to be sort of trying some things with you to see what's effective, right? And in those first 6 sessions, there are a couple things that you should be experiencing to know whether or not it's working. Number one, do you feel like you're making progress on this particular problem we presented with? Number two, do you feel that this therapeutic process is actually helpful to you? Is it good to have the experience of being listened to? Most people say yes, because most people in life don't have someone that actually listens to them with unconditional, what we call unconditional regard. Okay? Now, what you should know, and this is the last thing I'll say, is that our modern secular model for therapy, actually, historically, when you trace what therapy is, actually comes from the church. Because before there were psychologists, there were pastors who met with people, and many of which would hear people's confession. Therapy essentially is a form of confession, right? On some level, I'm confessing to a person I'm confessing to them the things that really hold me down, the struggles that I have, things that I don't really readily maybe share so freely, right? And if they're a good therapist, they will take what you say and hold it very carefully with you and walk with you through the process, offering meaningful insight. Therapy is a secular form of basically what Christian therapy was historically. Okay? So that then leads to the question, can a secular therapist help a Christian? And I would say because of this notion of common grace, God bestows wisdom generally to all of creation. I think that we can learn anything from almost anybody, but we have to be honest and say there are limitations with any kind of practitioner you're going to be meeting with, including a secular one. So what a secular person might help you do is problem solve, hear you out, reflect your feelings, keep you on task for short to long-term goals. That could be really helpful to you. But they don't have that foundation in which your life is rested on. Now is that a problem? It could be, in the sense that I've had experiences in which people went to therapists and they were very negative about religion. That's not how you train in therapy. If someone comes in and they say religion is very important to me, then you have to see that as an asset, as a means to help them. That's what a good secular therapist will do. Okay? Last thing I'll say, and I'll give it back over and say, just because you see a Christian therapist, this is very hard for me to say, just because you see a Christian therapist doesn't mean that they're actually the best person to help you. Okay? I've seen lots of Christians give bad therapy to other Christians, and people feeling like, well, they're Christian and they're a therapist, so what they say must be gospel truth, and that's not true. There's differing skill levels as for therapists. There are different circumstances in your life where you're only willing to kind of go so far, and it's not quite the time to commit to therapy. So keep those comments with a grain of salt. Liz is going to come back up.
Andrew likes to talk about these things. I like to go technical. So let me help you guys think about a couple things. So we talked about therapy. We explained kind of like what it works. And I brought to you 3 different researches just for you to have an idea. If you like to read research like me, you're free to go later and look at them. The links are there. But the reason, I want to give a quick reasoning why you use medication. And then I'm going to explain to you how do most of the medications work, okay? I can't go in depth about that, but I can give you a brief explanation. So, in terms of research, anyone can do any research, but good quality research is done with a lot of people during a lot of time, or you can also see what have many smaller researches done together, and then you just grab all of those researches and compare them. That's why I put in front what they are, so that you know that these are the good quality researches, okay? The first one is a meta-analysis, is when they look as something for long period of time. They look at different researches and compare them. And then the second one is a literature review, which means that this person that did the research went only through literature and said everything that has been written on that topic, do they have similarities or differences? And then the last one is a book on that topic, and then that book has, the second block of the book is all research. They literally present each of the research and what's the results of that, okay? What do they say? Well, they say that combining treatment with psychotherapy and antidepressant medication is more effective than treatment with just medication. The second one talks about how both IPT, which is interpersonal psychotherapy, which is kind of like what he was explaining, and cognitive behavior therapy, which we talked about last week, one of the most used and most effective types of therapy, they can be as effective as medication in acute treatment of depressed patients. So these are specifically for, they shared a few of the areas in which the research shows up. So the first one talks about major depression, panic disorder, and OCD. The second one is mostly focused on depression. And the last one, it's an overview of what the literature has said. And the majority of patients are receiving combined treatment, and this is what has shown more efficacy. So therapy is helpful, medication can be helpful, but if you have a mental illness of any source, combining them is going to give you the best results in general. Okay, that's just saying. So this is my way of saying, don't discard medication and just go to therapy. Medication can be helpful to you. At the same time, don't just take the medication and skip therapy. They can work together. They do different things to the body. For example, for patients that are in a state where they can have they're not processing cognitively well. They are they're in many states. For example, a patient that has bipolar disorder, their mood oscillates between very depressed, I don't want to see anyone and talk to anyone, to I'm very excited, I want to do everything, let me run outside for the next 3 hours, you know? It's really hard to see in therapy when you consistently oscillate. One time you don't want to talk to anyone, and the other time you're so excited that you can sit in the chair, right? So medication can be that piece that helps you get started in therapy. Does this make sense? For other people, medication is the thing, for example, people with ADHD, right? Medication sometimes is the thing that just helps them come to a level that it gives them just enough ability to pay attention. So now they can do things. And they might have to take that medication for a long, long time. So the use of medication is very varied. But my encouragement to you is, if there's a need, if the doctor recommends, you can try it. You can experience it, give it the time that it takes to work, and see if that's helpful to you. Because what research is showing us, and it can be very helpful, okay? So you'll say, oh, medication for mental health. What is medication for mental health? Well, it's hard to explain because you don't have this medication. It's when you're depressed, this is the exact thing that happens in your body, and therefore you have to take this specific medication. And then everyone that has the exact same problem is going to have the exact same medication. Because medication in mental health, they work with your neurotransmitters, which is the pieces in your body, the little guys in your body that connect. You feel something, they will transmit that information, the neurotransmitters will transmit that information, and they're going to get some sort of response. So for example, a positive response, you might have a surge of dopamine, which is the thing that makes you very very ready to do something. Or serotonin, which is the happiness hormone, for example. Those things, they are very helpful to understand. I will try to be as lay terms as possible, because each different type of medication, so there are 6 most common types of medication, which are here, and each of them has a different mechanism of action, which means that medication is going to try to do something in your body, either keep you, because from accessing too much serotonin, for example, if you're in mania and you're too excited, so you might take a medication that helps you, that might affect the thing that is making you feel too excited, and it will bring it a little bit down. But a medication for the depression might do the opposite. It wants to enhance that mechanism. Does it make sense? Okay. I'm trying to be simple. I end up using the wrong word sometimes, but I want to make sure that I'm saying it right. So, let's start with antidepressants. Their mechanism of action is that they inhibit, so they're going to keep serotonin from being retaken by the body. So you will release some, and your body keeps trying to get it back. So it keeps you from getting the second round of it. And these doesn't happen immediately. It takes 4, sometimes 8 weeks for that process to work, for the medication to work. Okay? And problems of sleep, appetite, energy, and concentration often improves even before the mood. So you might be able to sleep first, or you might have hunger again, or you might have energy to do something way before your mood lifts. But remember what Andrew was saying. It's about your quality of life is improving. It's not just your mood is improving, right? I'm depressed level 4. I'm still doing stuff. Okay, the medication might help you move to 5 or 6. And then your mood might lift later on. Does this make sense? But it's one of the ones that have the least amount of side effects, like headache or an upset stomach. And it's the kind of medication that you start with a very low dose, and then it will increase gradually. But from all of these, that's why they are the most used ones. They call it SSR1, serotonin, whatever, response inhibitor. Yeah. So this is the first one. It's used for depression, but it's also used for anxiety. It's also used for pain. It's also used for insomnia. Remember, one of the first things that happen is you sleep, which is one of the mechanisms that also helps with anxiety. Then the second type of medication that is commonly used is the anti-anxiety medication. It's called the anti-anxiety not because anxiety is something that you can see in your blood or your body and fix, but because its mechanism of action is really helpful in anxiety. People that present anxiety. You have different types. Sometimes they're going to use the antidepressants, the serotonin uptake inhibitors. Sometimes they're going to use benzodiazepines, which is the Valium or the Diazepam. I know people sometimes know medication by their names, not by their affection. Which is kind of like sedative, sleep-inducing, even muscle relaxing properties. So for someone that is very anxious and very worried, and their body is in high alertness, these helps them because it brings things down. It has like this sedative, anxiolytic, muscle relaxing property, okay? But it's a medication that can create dependency. So usually you use a benzodiazepine for a shorter period of time, and then you want to tape it off, and then you want to see how you're doing, and you can continue with your other therapeutic interventions, and then eventually you might have to take it again if you're going through a more anxious period. Do you know another thing that is used sometimes as anti-anxiety medication? Beta blockers. You know what beta blockers are used for? Heart conditions. So beta blockers block the release of stress hormones, adrenaline and noradrenaline, in certain parts of the body. So this slows the heart rate, reduces the force in which the body is pumped around the body, and that's why a beta blocker can be helpful for someone with anxiety, because you're trying to bring them down from their hyper-alert, hyper-concerned state. So you see, it's not like this medication is only used for this thing. This medication has a mechanism action that can be helpful. So it's used for anxiety, fear and worry, people that are having panic attacks, people that have social anxiety, okay? But, for example, the beta blockers in that sense, they can be used for people with diabetes or asthma for precisely that reason. Stimulants, they're mostly used for narcolepsy and ADHD, like Adderall. They increase alertness, attention, energy. So they increase dopamine and norepinephrine. So I just talked about the anti-anxiety. They want to do what? They want to reduce noradrenaline. This one wants to bring up dopamine and norepinephrine. And so they will elevate blood pressure. You see that they're doing the opposite effect of these medications. It elevates blood pressure, heart rate, and breathing, which, especially in teenagers, might mean some effect in the sleep, or even a little bit of a slow growth in teenagers. Antipsychotics, most people when they think about mental health medication, they're thinking about people with schizophrenia, they need to take something, they'll take an antipsychotic and they're going to be chill. Because psychosis is when a person loses sense of reality, right? So that's what we think. But that medication is also used for people that have delirium or dementia, the later stages of life especially, because its focus is to try to block dopamine and the dopamine receptor and the serotonin receptor antagonist action, which is, I hope it made sense for someone. Basically, it's trying to keep their, whatever it is acting against them, keep them from working, the antagonist from those hormones. So you want those hormones to be working, but you don't want them to be overworking. So this medication is very interesting. And antipsychotics, they don't work like the other medications in the sense that there's a lot more side effects. It can take over 6 weeks for medications to work. Not everyone responds to the same antipsychotic. Because of the multi-causality of psychosis, for some people it's a medical treatment. It's not even necessarily a mental health treatment, it's a medical treatment that's going to help deal with some parts of whatever's going on in their body. Then they will have this as an add-on, the antipsychotic as an add-on to help them deal a bit with it. So it's more complex, and there are various different types. There's first generation, second generation. One works in a way, the second work in another. Some people respond well to the first generation. Some people respond well to the second generation, because it's hard to know where the psychosis is coming from. It's hard to know exactly what is going on in the body that is causing that. So you try to figure out, okay, which medication can be helpful here to help counter some of those symptoms. I hope y'all not going crazy yet. I have a last one. The last one is a mood stabilizer, which is mostly for people that have like bipolar disorder or mood disorders in general. Usually they're going to use something called lithium, and it is also sometimes for people that have depression, lithium might be combined, so they will be taking an antidepressant plus a mood stabilizer because it augments the effect of that medication. And sometimes they might take anticonvulsants. That can also treat people that are going too quickly between mania and depression and mania and depression. Anticonvulsant can help because of the way it acts in the brain. But these medications, I put them in a certain order. These ones, you keep, the doctor knows what's going on, they can be taken more safely, the side effects are lesser. As you go this way on the screen, these medications require a lot more monitoring. Some of them, for example, Lydian can affect your kidney. So you need to make sure you're going to do blood tests to make sure that the amount that you're taking is not affecting your body. Because again, you're trying to see how you can counter some of the things that your body's doing, but at the same time, you need your neurotransmitters, you need your hormones to be working. So the doctor needs to figure out, okay, is this medication, is this amount of medication, is the timing of the medication helping? If not, let's taper off this one. It takes a while, and that's a warning that I want to put here. You don't just stop taking a mental health medication. You need to give it you need to taper it off. That's the expression that we use. You need to slow down taking it and then stop taking it. I always recommend doing that with the doctor. Then you can taper off medication. Once you're out of it, you can try on your own, without medication, just with therapy, just with other support, or you can try a different medication in a different dose to see how you respond. This was my technical piece. I hope I didn't bore anyone to death. But the idea is for you to understand that it's a trial. It's a playing around. What is working for me might not be what works for you. Oh, I have this problem, I have to take this, right? But you have that problem, the same problem, you might have to take something different, or a different dose, or a different brand, or a different generation of the same product, so that your body will respond differently because our bodies are different. And our mental health issues come from many different areas, right? They're not just going to improve, take medication, everything is fixed, because they have social, emotional, relational aspects that are feeding into it. It's not just a physical issue. Does it help? Okay. And if you didn't understand a word that I said, I'm sorry. I can help another time. But the general idea is that there are different types of medication. They work in different ways, and they can be helpful. Do not negate the common grace that God has given, that people have been studying for years and trying to figure out how can we help some people? How can we help them be able to engage again, be able to improve their functioning, their cognition, even be able to partake in therapy because they are in such a state that they can be talking to someone else and growing in that sense. Stigma is a problem because it's so common because people think that if my mental health problem is a physiological problem, there wouldn't be stigma, right? If mental health was just a physiological problem, like diabetes or, I don't know, help me out, a heart condition, if it was just that, it's physiological, right? You might need a surgery for a kidney problem, or you might need a medication for your heart. There's no stigma. Does anyone ever bother you for taking, I don't know, Tylenol for your headaches? That's kind of expected. Have a headache, I'll take Tylenol. Or have a fever, I'm going to take, I'm in pain, I'll take some ibuprofen. No one bothers us because of it. There's no stigma around it. But once it involves your will, once it involves relationships, once it involves these things, then the stigma starts. We think that you should be able to do better. Have you ever heard that? You're going through something hard, you're like, you're not trusting God through that. That's your problem. And the reality is, you can be trusting God and you can be having good relationships and you still be struggling. Because it can also be physiological. So, The three questions that we want to try to answer, there's actually four, there's a fourth question. But these three are the ones that are directly related to medication in that sense. The first one is, will people think that by faith that God can fix it? It doesn't matter. Doesn't matter what people think. That a lot of it can be controlled. A lot of it is, again, multifactorial, so you have to be doing a lot of things. But if you are growing your relationship with God, if you are pursuing healing, pursuing a continual on the redemption of the body and the mind and the whole human being that you are. Remember, we talked that we are embodied souls. This is what people think really matter. Or does it matter more what God thinks about you? Does it matter more that in your process of healing, you were pursuing everything you can, everything that God has made available to you? If people think that the fact that you take a little medication or the fact that you go to therapy makes you a weaker Christian, you shouldn't care. And I know it's not easy. Been there, done that. But you trust that God, He has made you, has given you resources to heal and to grow. And you go and you pursue them and you trust that He is using the people, the professionals, the pastor, the small group, the whoever resources the Lord has put to help you heal right now, that they are there and they are part of God's grace to you. And did you want to ask the next one?
Will I become addicted? Will I become addicted to medication? And Lindsay alluded a little bit to this earlier. There are certain controlled medications that can be habit forming. Not all of those. So those are benzodiazepines, opiates, stimulants. Those, if they can become habit forming for people, and so usually though a good doctor, when they prescribe them, is going to either, in the case for instance of pain management, give you a very limited number of pills to deal with it, nowadays especially because of the opiate epidemic. And then at the very least, they're going to require that they see you on a monthly basis to see how you fared with taking the medication. How do you know when a medication is becoming habit forming? Do you take more than prescribed? When you take it, do you take more than prescribed at the time that you're supposed to only take one dose? You take 2 doses? Do you run out before your medication is set to expire? Those are kinds of things that would be indicative of this is starting to be habit forming. Also with these medications, that if you start taking them and then you stop abruptly, there are harder side effects to cope with. So it's important that when you take them as prescribed. You have ongoing follow-up with your doctor. Can I trust God with my struggle and still make use of medicine to deal with it? Absolutely. Absolutely. Because sort of what I was talking about today, right? So trusting God does not mean there's going to be an absence of all kinds of suffering and pains in my life. It's not indicative that that I'm lacking faith because I'm going through some form of suffering. Mind, body, soul, physically, spiritually, etc. Right? That's not a sign of lack of faith. What is a lack of faith is that when I'm going through something, what is a lack of faith is that when I go through a trial, I'm reluctant to walk with God through it. Because God wants to walk through all our trials. So when you're coping with depression and you're taking medication to help with your mood and to get, that's an opportunity to deepen faith. And the taking of medication doesn't mean that you lack faith. It's just one of the ways in which God gives us resources to flourish. That's how He made the world. Okay. This one?
Yep.
All right. This is a good one. We got one question sent in, so here we go. In recent years, many young people, especially in Asian countries like Japan and China, would not actively seek jobs, but instead spend all their time on the internet. They have no physical illness, but just don't want to work. They make no contribution to the families, but rely on their aging parents and grandparents to provide their needs. I think this person has a strong opinion about it. They don't see work as a meaningful way of life unless it can provide them with a lot of money and perks. If they cannot find a job to their liking, they will continue the above lifestyle. Their behavior obviously creates a lot of pressure on their parents and grandparents, but they just don't care. Should we see this kind of behavior as mental illness that needs treatment, or moral failure, or even wickedness that needs admonition? Okay, that was a lot. So I guess what I would say, this sort of gets to the core takeaway of this class, which is like, when you see an individual struggling, the first response, and the only way that people really get better, is when someone responds with compassion, first and foremost. Right? People don't get better, whatever their problem is, unless the person on the other end of it experiences compassion. Right? Unless the person on the other end is showing compassion, excuse me. So then when someone is struggling like this, the first thing we want to know is what's going on for them. When did this problem start? What are the causes of it? When have they been doing better with this particular problem? When have they been more active? And that's one of the things that therapy will help people kind of start to sort out, which is like, what are the reasons I'm doing the things that Paul says I don't want to do? Right? And why am I doing the things that I don't want to be doing? Or what are the things that I'm not doing that I should be doing? That's the other piece of it. Right? So therapy, when you're sitting with someone skilled on the other end, can help you sort that out. Now, in the process of being, if this is a Christian going through this, I would say all of life as a Christian is repentance. Every day, right? But we repent and confess our sins in the face of one who has died for us, right? Who receives us every single time, right? So it's not meant to be a shaming sort of thing. It's instead meant to be a freeing sort of thing. God wants to release us from the things that burden us. So if a person is having particularly difficulty with motivation, they could benefit from just talking to someone who could then start laying out some things, some short-term goals that they could work on. Or maybe this person is not motivated because they've suffered a particular loss or grief in their life that they haven't worked through. So in that case, they're going to have to do some interpersonal work. All that to say, the reason for this behavior, I almost fell there, you see that? You caught me. The reason for what we see as behavior is always more than meets the eye. And what we need to do is to learn what kind of behaviors we exhibit to each other that motivates some sort of change. Yeah, Charlie.
This question, I think, alludes to a phenomenon that happens in Asia. The Japanese have actually coined a term for it. It's called hikikomori. And it's...
I had that for lunch yesterday. I'm sorry, go ahead.
And it afflicts East Asia for some reason. And it's societal, and there are like hundreds of thousands of mostly like young men that basically turn into hermits and don't go out. But it's certainly it's a trend. It's like
sure.
it's a macro trend.
Yeah.
And sometimes when there are macro trends like this, I tend to think that there's something more to it than just kind of individual, failure. Obviously, that's a big component of it.
Right.
And it seems like the more that these types of people are admonished for their behavior, the more shameful they feel,
yes.
and the more they retreat.
Yes,
into this
unless
lifestyle.
they are changed. Yeah.
Can I contribute to this conversation? So I think it's important for us to think. A lot of what we talk here was about the individual piece of mental health and how we as a community can come alongside one another, right? That's what we've been talking about the last, 6 weeks. But what you're mentioning, it's something that I studied back in college when I was working directly with families. And why do people in Brazil respond in a way to things? Why do people in, Japan respond differently? And there is a piece of our, I don't want to say mental health, but I would say resilience, or our ability to do things, or our ability to endure things, that comes from the experience that we have lived collectively. So, for example, why you'll see there's like higher rates of suicide in these Asian countries, right? There is something happening with the population. There's something happening culturally that is affecting them. Why can we look now and see that in America, especially here in the United States, since the rise of social media, the mental health of teenagers has gone down? These things are more than just individually, right? There is a cultural piece in there, which is what John is referring to. And which is why I think community is so important in that sense. Because community is the thing that helps us live in a space where we can encounter culture, right? Or families or immediate community. So kids that have a stable family, that has some good boundaries, that has great communication. Because boundaries without communication actually creates more struggle. You need boundaries and you need communication. If you have good communication in your family and you have good boundaries, now you have kids that are growing in a healthy environment. So even if things are happening outside, the culture affects them in a different way. If you're in a community that is very supportive, if you're in a community where you can be honest about what's going on, where you can share with each other, those effects that the culture affect in us can be countered. So countries like Japan, for example, what's honor is really important. It's very common that suicide happens because you lost your job or something, and then you can't continue to provide for family, or that you didn't achieve something that you were looking for. You didn't get into the job or the school, whatever, and then now the torment, the honor, like I have dishonored someone. In Brazil, the core of the culture in Brazil is comfort. So if this is uncomfortable, people will avoid doing uncomfortable things, or they will find something that we call the jeitinho brasileiro, which is like an easy way to get around things, which is why Brazil is so full of corruption. It's like there's this comfort, we want what's comfortable to us. But when you're in a community that doesn't accept just what is comfortable, that helps you walk through the discomfort of doing certain things that are hard, that don't accept just the way that things are being done out there, we're going to do our job right. We're going to find the easy way out of it. We're going to do it right. And then you're doing that together in a community with people. So that's why we don't talk just about, we didn't want to talk just about the specific one thing that people can do or one action that you can do individually, but we wanted to bring you this whole picture that you need a community. The community is a very healing space. It's a space that provides a healing. A good community will do that. Your family, your church, the people that you have chosen to be part of your village. But don't neglect also the other resources that are available to you. Because even if you've been affected by the things of culture, these things can be helpful too. Do you want to say anything else? I just goes. Thank you so much for coming. Thank you for being here with us. I hope this was helpful to you. I hope this helps our community grow in our understanding of mental health and care for each other. Thank you very much.